Okay, listen to me. I'm going to tell you something really important. So, I recently found out this concept and now I had to share it with you. Listen to this case. Wait. Okay, so this is the case. As a nurse, you will be responsible for educating your patient about the disease of leprosy and its treatment regimen. So, how will you know if the patient is receptive to your teaching? And what if the patient shows no interest in learning? How will you encourage him to learn? So, with this case, I am going to answer 4 questions. So, I have a copy of my notes for me to fully explain it. So, first question, what is leprosy? So, leprosy is known as a Hansen's disease. It is a chronic communicable disease spread by prolonged intimate contact with an infected person. Peripheral nerves are also affected, therefore it can cause a sensory loss and skin involvement is present. Lesions may be confined in a few isolated areas or may be fairly widespread all over the entire body. So signs and symptoms are seen after 3 to 5 years. If you see any of these signs and symptoms, consult your physicians for further instructions such as laboratory examinations and diagnostic tests. For the second question, how to treat a leprosy patient with a leprostatic drugs? So for tuberculoid leprosy, it would be a 12 months of treatment using rifampicin and dapsone daily per RM. On the other hand, with a leprosy, would be 24 months of treatment using rifampicin, dapsone, and clofazimine daily per RM. So these drugs are bactericidal and bacteriostatic against Mycobacterium leprae, which causes the disease leprosy. Please do take note of the adverse reactions of each drug. We also need to take consideration of the factors such as involvement of the family or community as the support system of the leprosy patient. So now, the third question is, how will you know if the patient is receptive to your teaching? So first, if the patient asks further regarding leprosy. Second, you may also ask the patient to repeat or summarize what you helped teach them. And last, you may also ask the patient something regarding what you discussed to know if the patient really understands. Lastly, how about if the patient shows no interest in learning? You may tell the patient that he or she can share it with his or her family or community. So, let us not forget and take into consideration the stigma that we have. Look, people are not disgusted to others who have coughs and colds, yet feels the opposite towards leprosy. Next is that we need to consider their emotions because they might be too affected in a way that adverse mental conditions may occur. And oh, by the way, in biblical times, leprosy is also known as a punishment for sinners. If a patient is being religious that he supports the belief, aside from he will not make an effort to be cured, the patient may also spread the disease. With this, we would want to reach out to the support people of the patient in order for them to encourage the patient. So, I'm sorry if I spoke too fast. It's just an urgent case. If you have any insights, please feel free to comment down below. Also, please do like and share it to your family, friends, and community to stop the stigma and be aware. Again, sorry for the mood.